Recognizing the early signs of ADHD or autism can be very challenging, especially when behaviors overlap or seem subtle. So let's break down some key indicators to help you navigate this journey. Hello and welcome to Glow Pediatrics. I am Dr. Hokehe Eko, and today we are diving into a topic that's close to many parents' hearts: understanding the early signs of ADHD and autism in their children. So, Autism Spectrum Disorder, or ASD, often presents in early childhood, right? I've heard parents say to me in my practice, I knew there was something going on with my child even when they were babies because of the way, because of the lack of eye contact when I was breastfeeding them or feeding them, or because they just didn't want to be touched, or they just noted some differences. So there are early signs that can occur. And so here are some signs to watch for, right? Limited eye contact, delayed speech or verbal communication, repetitive behaviors or routines, sensitivity to sensory inputs like sounds or textures, and if your child has difficulty with social interactions. Also, it's important to remember that every single child is unique, and these signs I've mentioned can vary in intensity and in combination. So meaning you could say a combination or plus or minus one of those signs I mentioned, right? And so the other thing that often shows up in early childhood, or at least the symptoms of it, is ADHD, or attention deficit hyperactivity disorder as it's commonly called, right? So here are some key signs to note. If your child has inattention or difficulty focusing, hyperactivity, constant movement, impulsivity or acting without thinking, difficulty following instructions, frequent daydreaming or forgetfulness. Again, there are differences between boys and girls, and we'll deep dive into that in another video. But it's important to note also that, ADHD cannot be diagnosed as of right now in the US until the child is at least age 6, because it's important that the behaviors that we're concerned about occur both at school and at home. So it's hard to tease it out, right? How can you tell a 3-year-old is hyperactive? Because usually they're running around, they're jumping around, they're playing, and that's what we expect, and that's what we want to see from a 3-year-old. So we often will wait till the child is at least 6 years old or in school to start to determine if there is more hyperactivity than you would usually find in that age group. How can you differentiate between autism and ADHD? That's a great question. So yes, I have mentioned signs to look for both ADHD and autism, but it's important to note that while behaviors overlap, there are some distinctions between ADHD and autism. For instance, both may involve attention challenges, right? But the underlying reasons differ. So it's important to understand that these nuances are present, and so that helps us clinicians to determine effective interventions for your children. Why is early intervention important? And really, what does that term mean? Early intervention means putting in place therapies or medications, as the case may be, that will help your child. It will help the trajectory of your child's life, that will help improve outcomes for your child, right? And it's always important to note that the first 5 years of life is absolutely critical to making changes for our children, because that's the time of the most rapid brain growth, right? And so if we're going to make any changes or any interventions, we want to do it as early as possible. And that doesn't mean that if your child is over the age of 5, all hope is lost. Not at all. It's just that for those parents listening and you have a young child and you may be concerned that there's something going on with your child, please seek help early. Always better to find out earlier than later, so that interventions and therapies can be put in place for your child, right? So like I've said, early intervention significantly improves outcomes. I've seen children who had difficulty with speech, they started on speech therapy early, hearing is checked, and I've seen speech is so much more improved and better, and as opposed to not getting into speech therapy early or until 5 or 6, and it may take the child a little longer than it could have, right, for speech to come in. But of course, you always have to look at what are the other underlying reasons going on, right? So at Glow Pediatrics, in our practice, we implement a holistic approach to every child. Every child is different, every child is unique, and so we do personalized care plans for our children, and we encourage parents to not be afraid of finding out if your child has ADHD or autism, because the earlier you do, the earlier you can get therapies and nutritional holistic interventions in place, because that's what we do at Glow Pediatrics. We combine both conventional medicine, but especially holistic medicine, environmental medicine, parent-led ABA training. We provide supplements, but more importantly, we teach you parents how food is medicine, right? How can you give to your child what they are missing in the form of food versus just supplementation? And so it's important to address this, like I've said, early on. And again, in our practice, we understand the challenges that parents face from managing behaviors to navigating treatment. And so we approach it as a whole family treatment protocol, right? It's not just the child, it's the entire family. So parents, I just wanted to encourage you that if you suspect your child may be showing signs or symptoms of ADHD or autism, early intervention is critical. Don't wait. Reach out to us and book a consultation. We're always happy to answer all your questions. And please share this video and subscribe to this channel. Share it with others who you think may need to hear this, right? And know for a fact that you are here. We are here to support you every step of the way. And you are valuable. Your child is valuable. And you matter. And you're the best parent for your child. I want you to remember that. So have an amazing day.